Hello, in this video we're going to cover other observational study designs. Last week we talked about two primary observational study designs, case studies, or case control, and cohort studies. These are the objectives for this video and for this chapter of your book. So we're going to describe 4 other study designs used in observational studies, why we would need these other observational designs, describe when they're appropriate to use, and the limitations and potential design enhancements that can improve these study designs. So why would we want to use these other types? Well, when a direct observation of a population is difficult, when a randomized controlled trial is not possible, when causal associations are not necessary, when traditional or primary epidemiologic study designs are not possible, like a cohort or case control, and when the question of interest does not fit other study designs. These are 4 primary other observational study designs. This table is taken from your textbook. And the first one is a cross-sectional design. This is when you assess a population at one point in time. So a couple things to consider are the population that you select for the study. It should match the population of interest. The extent to which your observations are generalizable to the study population, from the study population to the overall population of interest is important. And so in order to maximize generalizability in the selection of your population, sampling is really important. So you're not going to collect data from everyone in the population. Instead, you're going to collect data from a subsample. So there are different types of sampling that you could utilize. You could use representative sampling, so obtain a sample of respondents representative of the overall population. Non-representative sampling, which is the opposite. Random sampling, where you select a subset of the overall population through chance or a random process. And through this type of sampling, this ensures that the population selected for the study is representative of the overall population. However, non-response among randomly selected respondents can compromise representativeness. And then you have a stratified random sample. So this is where you would select a random sample from among strata of the overall population. Again, this ensures random selection process, which includes a representative sample of respondents for an important characteristic of interest. So for instance, the sample being balanced on age. But in order to do this successfully, it requires a good understanding of the characteristics of the strata for the source population. Then you have convenient sampling, so a sample of respondents conveniently available to the researcher at a given place or time. So an example from the textbook was sampling patients who come to the pharmacy at a specific time and day of the week. It allows for easy collection of patients. However, it does not necessarily produce a representative sample of the patients. So patients who use the pharmacy services on Sunday may differ from those using pharmacy services on Tuesday. And then you have purposeful sampling. So here's where you're sampling a select group of patients who meet specific criteria. So for instance, sampling only patients over 65. This type of sampling does not produce a representative sample of the overall population of patients. Patients who are 65 and older could differ from other pharmacy patrons on important characteristics. Data collection can be done with using retrospective data, so data that was already collected from another study, or you can collect data prospectively on a population through the use of a survey, which is a standardized questionnaire to collect information. The pro of the collecting it prospectively is that you can create questionnaires to capture all the information that you are interested in. However, this can take a long time to collect. Whereas retrospective data collection, the data's already been collected, so it's available for you. However, you might be limited in the types of information you have. Most cross-sectional studies are descriptive and do not require statistical analyses. They usually report average among the population or report a percentage of population with a characteristic. The associations between 2 variables collected from the same cross-sectional study should be examined cautiously, and this is primarily due to this bias of temporal precedence. So what this means is that information on an outcome is collected at the same time as the predictor, which makes it difficult to know whether outcome preceded the predictor. There are a variety of strengths and limitations. So one strength is that you efficiently capture information on a population through the process of sampling. Generalizability of the results can be threatened by non-response. Causal association should generally not be made due to bias of temporal precedence. And these studies just capture prevalence, but not incidence of new cases, given that this data is collected at one time point. Another type of observational study design is a pre-test, post-test. And in these, you're observing a population before and after an intervention, and to see how the population is affected by that intervention. This limits the bias of temporal precedence in a cross-sectional study by observing the population prior to the intervention. This is a basic design, study design. Here we have 0-1 is observation 1 prior to the intervention, so maybe a questionnaire or blood pressure or something. Then you do your intervention, which is designated by the X, and then at 0-2, this is the observation 2, the second observation taken after you had implemented the intervention. And basically you're just comparing your two observations pre and post to see if there's a difference. Data collection can be done retrospectively or prospectively. So retrospective is common when existing data are available before and after a naturally occurring change in a population. This is common when a researcher learns of a population change after the change already occurred. However, prospective data collection, it's feasible if a researcher has advance notice of the change that will occur in a population. And it requires collection of data both before and after a change at two points in time on the same population. So while you might be able to capture all information that you're interested in a more controlled way, it can take longer to be able to collect prospective data. Comparisons are made by differencing the outcome of interest after the intervention occurred to the measurement before the intervention. Major strength is that it eliminates the bias of temporal precedence common in cross-sectional studies. However, there are a variety of limitations, and these should look familiar to you from the randomized controlled trial video and chapter. So you have potential maturation effects, so natural changes in the outcome that occur independent of the exposure of interest. Potential history effects, additional changes occurring in the population which may be confused with the effect of the exposure. And then regression to the mean. So extreme values at pre-test leave more room for a score to approach the mean value than might otherwise be expected. There are some design enhancements that you can do with pre-post designs, and this is a table giving you an example. So in the first example, in the first row here, one group, multiple pre-test, post-test. Here you're going to take multiple observations prior to an intervention and then the intervention, and then the intervention and then another observation. So here in this example we have two observations, then the intervention, then a third observation. This allows you to examine potential maturation or history effects. You could do a one-group treatment switching. So here you take an observation, you do the intervention, take another observation as your post-intervention, then you remove the intervention and do a third observation. And so after the treatment effect is observed, the treatment's removed to see if the observations return to baseline values. And then lastly, another enhancement can be a pre-test, post-test with a non-equivalent comparator. So the pre and post measurement is taken on a population in which the treatment occurred, as well as a non-equivalent comparison group which was not subject to the intervention. So the observations are taken at the same time point in both groups, but only one group receives the intervention. The other group doesn't receive the intervention, is waitlist or something. And then the second observation in both groups is taken around the same time. Next kind of observational study is a time series analysis, and this is where multiple observations are made over time, both before and after an intervention. This allows a researcher to examine trends in an outcome before an intervention, and allows them to examine changes in the trend of an outcome resulting from the intervention. This is an example taken from the textbook. Here we're looking at monthly spending on antipsychotic medications that is being tracked prior to policy restricting spending on antipsychotics and after this policy is implemented. And so what you can see here is that there's a very slight increase in spending on antipsychotics. The policy is implemented by this black line here. And then there's a very short-term reduction in the level of spending the month after the policy is implemented. But then spending increases, it starts to increase again at around the same rate as it did prior to the intervention. So most of these studies are performed retrospectively, since it would be costly and difficult to obtain numerous observations in a population over a long period of time. And usually the data are summarized over fixed intervals. For instance, in that figure, it was monthly. So instead of daily, it's monthly. There are a variety of strengths and limitations. So strengths include reducing bias of maturation by examining natural trends in the outcome in the absence of the intervention. It also allows the researcher to see immediate and sustained changes resulting from the intervention. But some limitations are that additional changes occurring in the population might be confused with the effect of the exposure, and the loss of subjects over time increases the longer people are observed. One way to strengthen time series study design is with a comparison group. And so here, the blue line is showing you the group that we just saw on that graph previously with antipsychotic spending. And here now we're adding a comparator group from another state in red, and this is showing you what, it's comparing an outcome in this comparison group in which the intervention was not conducted, which can show how the outcome may have changed in the intervention group had the intervention not been implemented. So there is a decrease with the policy once the policy is implemented in spending, but then we saw this slight increase at a similar rate as before. However, had the policy not been implemented at this time point, it could have been that our blue line would look more like this red line. So it gives you a little bit of an idea of what could have happened without the intervention. Lastly, ecological studies make comparisons across groups of individuals instead of the individuals themselves. They're commonly used to compare groups or populations or people when data on the individuals comprising those groups is not available. These are aggregated comparisons that are made across different groups. And I'm not going to go into it right here, but there are a variety of ways in which you can make these comparisons between groups using different statistical tests, which are listed here and will be covered more in depth later on in the semester. Some strengths to ecological studies are that existing data are often available on populations of individuals that may not be available on individuals themselves. For instance, through the use of registries or census information, there is very low respondent burden. However, one major weakness of these designs is this ecological fallacy. So you're making observations or you're getting information about a population instead of an individual. So ecological fallacy is where you inappropriately infer an association among individuals when making observations across groups. Just because something applies to a group as a whole doesn't mean that it would generalize to the individuals. In summary, other observational study designs are useful when used appropriately. Each other observational study design has important limitations that should be considered when conducting and reviewing studies using these study designs. Many study design enhancements can reduce limitations from these studies and should be used when available.